Orthopedic surgery, as you can definitely testify, it has a unique culture. I saw a statistic that said by 2030, 60% of orthopedic surgeons, or over 55% of orthopedic surgeons will be over the age of 55. So how do you think through this aging orthopedic population as culture that either transfers or gets redefined?
Well, I mean, yes, it's an aging workforce, unfortunately. And so as we transition into how do we, I should say, prepare for this excess number of patients, but fewer number of surgeons, and that's going to be the hard part, because unfortunately, like even as our residents, like we try and get more residents, we're also limited by some of the capacity that we can graduate them in, and some of the duty hour restrictions. I mean, when the 80-hour work week started, I mean, unfortunately, some people need more reps and some people get it. And if you're limited by 80 hours for some, I'm of the belief that you may take more than 5 years to get good hands. You may have the knowledge base, but if I call it your PlayStation time as a kid was limited, you might need a little bit more time working with tools that could cut your finger off so that you're actually somewhat safe. And it's nothing bad against some. It's just, some people can pick up a golf club and be great at it, and others, it takes 10,000 hours to be able to hit par on a given hole. And that's, I think, the challenge with this, again, the aging workforce is we're going to hit a supply-demand issue, and I don't have a great answer as to how to fix that. Whether it's, are you a Dr. DeBakey, like, and you operate until you're, God knows, in your 90s, or hip and knee replacement is not an easy profession. And luckily, industry has now come out with tools, whether it's for total hips, it's impactors so that I don't have to hit an implant 200 times to get it in. And knees, with using burrs and whatnot is a little bit easier, but it is still it places a toll on your body. And thank God GLP-1s have made people skinnier, but we still got big people too. And when I have folks try and lift heavy patients, you're tired at the end of the day. So how do we prolong longevity? I mean, we can get into the whole health and wellness on physicians, but we also have to take care of our own body, and that's what I try and tell our residents is, remember, you yourself have to take care of yourself. And not just mentally, but physically to be able to do this. Probably, hopefully not till 90, but if that's what you want to do, God bless you.
It was a perfect tie-in, and I think you answered it. My next question was going to be focused on, I'm seeing the conversation shift from we're burnt out as orthopedic surgeons to almost taking this hybrid athlete approach. I mean, you're an athlete and looking at the career as performance development, surgical longevity, health longevity. Anything else to add to that besides the obvious, hey, within this career, we've got to treat ourselves like our athletes?
I mean, it's a very perfect example. If you look at what I call true professional athletes, their career is defined by them staying healthy, right? Unless you get the big signing bonus, which no one gets in orthopedics, that'd be great. I'm happy to do NIL deals on scrubs, but you have to stay healthy. And whether that's mental wellness or physical wellness, and unfortunately, as we all get older, that we take for granted the health part. And whether it's your cardiovascular health or, we all need to probably do some sort of resistance training to prevent back injuries, things like that. But you have to invest some time for your long-term health. And it's hard when you're 40 because you otherwise feel pretty good. It's kind of when you're 60, you wish you would have told yourself something when you're in your 40s. And that's why I really started to invest in my own health and well-being now that I'm in my 40s. So that when I am in my 60s and 70s, that this profession that I've loved has not literally destroyed my body, that I'm having to resort to watching Netflix all the time because it's hard for me to bike and go hiking, things like that.